Hi, I'm Tyler Luthringer. I'm a shoulder and elbow and hand and upper extremity specialist here at CONA. This is a topic that's very near and dear to my heart because as a young ski racer growing up in the Northeast, I suffered multiple shoulder dislocations and ultimately came to require 4 different shoulder surgeries to finally stabilize my shoulder. So this is a topic that I really feel a connection with my patients when I meet them, and especially after they suffer a first-time dislocation, and I'm able to use my experience and everything that I went through to kind of help guide them and coach them through the appropriate steps to take. So the shoulder is an inherently unstable joint because it lacks a lot of the bony constraints of other ball and socket joints like the hip. When we think of the shoulder, while we may say ball and socket joint, the shoulder is actually more like a ball on a dish or a ball on a golf tee. It relies heavily on different restraints, both static and dynamic, to maintain the stability of the shoulder and to prevent instability and dislocation. The glenoid labrum, which is a cartilaginous ring around the glenoid socket, as well as the capsule and ligaments, are the primary static stabilizers of the shoulder joint. The shoulder joint also has dynamic stabilizers, namely the rotator cuff muscles that help to keep the ball of the shoulder joint compressed to this shallow socket. So over 90% of the shoulder dislocations that happen in the anterior direction. That means that the ball of the shoulder joint comes out the front towards the front of the chest. And this commonly happens in a position of the arm being kind of raised at the side and externally rotated like this. With each shoulder dislocation, one of several injuries or trauma to the localized tissues happens. Oftentimes, the capsule can stretch or become loose. The cartilaginous labrum can tear, and that is what's called a classic Bankart tear. And other times you can have a fracture, either of the glenoid rim or of the humeral head, which is called a Hill-Sachs lesion, or sometimes both. Due to a lot of research that's been done, we know that with each shoulder dislocation, the likelihood of having a subsequent dislocation increases significantly. This happens to be particularly true for young athletic males who play contact sports. And I learned this the hard way, but initially I didn't seek treatment for my shoulder dislocation, and I kind of just went along dealing with subsequent dislocations and ultimately suffered worse and worse trauma to the structures inside of my shoulder until I ultimately had to have it checked out. So I really think that it's important to at least come in and have a conversation if you experience one of these events. Oftentimes the shoulder after a dislocation for the first time is sore for a few days, but then it goes back to feeling pretty normal until a dislocation event happens again. So if you experience this, I'd like to come have a conversation, with you and your family, just so I can guide you through this process and we can talk about what it may mean for you in the future and come up with a plan together.